Hey YouTube, I wanted to show you Sneezy. He's a cat that I took on. He was a stray and he wound up getting this wound from fighting with raccoons and other cats. So he's kind of an aggressive cat. But anyways, I took him to the vet and got him looked at, and they were really surprised at his wound. It was actually larger. But I wanted to video this to show you guys what you guys can do if you're not familiar with how to wound care for a cat. I've educated myself, and I just wanted to show you what it is that I've been doing. So what I have here is something called Medihoney, and I've got these non-stick bandages. So these are the bandages that you use. They're kind of like anyways. So what I do is I squeeze this Medihoney onto the bandage, and we're going to apply this to the wound. What this Medihoney does, you could research it for yourself, but it actually helps the wound heal. So this is a two-part process. It requires two people. What we have here is the wound. So we have somebody holding the leg and squeezing back here by the shoulder to extend the leg. And then I have the Medihoney patch. So we basically just put it over the leg here and then just gently apply it without putting too much pressure. Then we take this elastic bandage and we just wrap it very carefully. So again, this requires two people. You want to make sure not to over tighten the bandage, and what I do is I loosen the bandage up and then roll it back up so there's no tension when pulling the bandage. So here, we'll show you how I do this. So this bandage sticks on itself. You can find this at Walgreens or Walmart. Anyways, so you want it tight enough so that it doesn't slip off, but at the same time you want it loose enough so that it doesn't cause circulation issues, and you'll be able to tell by the color. Just check the foot. But I want to go up over the shoulder area here. So see how it's kind of stuck? It's better to unroll this first and then roll it back so there's not a lot of tension, so you don't have to pull on the wound. Here's his little elbow, Sneezy. Now we call him Sneezy because when he came to our door, he was sneezing quite often, and so we took him to the vet. He had a respiratory virus. The name just stuck. So anyways, he also has AIDS, cat-acquired immune deficiency, so his wound healing abilities are weakened. So we had him on antibiotics, but I'll show you pictures of the wound previously. This is, believe me, by far much more. I'm just going to go ahead and use the last of this, anyways, you can see. And then just stick this tape down on it. There we go. And then just give it a little, it's like a little cast. It's flexible, you can see. And he's got room here. So anyways, how you doing, Sneezy? Okay, so here's Sneezy. I've been wrapping him now for about 2 weeks. The wound is much more improved. It was all infected and smelly, and now you can see he's got this nice clean environment here for his wound to heal, and he'll probably get some chicken snacks. So anyways, I'll keep you posted, and we'll follow my progress on how this wound is healing. I just wanted to add real quick, this is something I got from Tractor Supply. This is a good first step. What it does is it kind of cauterizes open wounds. You don't want it's a powder you put on the wound. It actually stings the patient, but this is just a good 1 or 2 day use, and then after that, what it does is degranulate the wound and help it clean up. So you can do a little research on this, but this isn't something you want to use often. This is just in the beginning stages of the wound care. And again, here's the Medihoney. This is a really good product for helping to create an environment that the wound heals a lot faster. This is the spray that we use to kind of help clean, initially disinfect as well. If the wound is really dirty initially, you can use peroxide and this betadine. Also, we soaked him in a warm bath. We even put a little bit of Clorox bleach in the bath to kind of help disinfect any bacteria. And so those are the first measures we did to kind of clean and debris the wound. It was so nasty. It was stuck with black, hard plasma blood and dirt. So when we found him, and you could smell the infection, he was not in a good state, but he's doing so much better now. And then we hope to adopt him out. I think I have a family for him, but we're hoping to adopt him out. Sneezy. Hi, Sneezy. He doesn't want to look at the camera. Anyways, guys, hope you appreciate the video.